We are going to talk today about the use of biomarkers for dementia detection in the MENA regions, some opportunities and challenges.
I think at this stage, when you have late stage or middle stage dementia, biomarker has not a big role to play unless it helps you in differentiating what type of dementia the patient has. So, for example, the tau P271, which is a blood test, it will tell you specifically that the patient has Alzheimer's disease. Then probably yes, it has a role. But just for confirming diagnosis of dementia that you already have, I don't think it is important. Biomarkers are important in early detection, preclinical, and even if you want to stress preclinical is very important. You ask about screening. Screening will be important in preclinical if you are ready for it. Because when you have disease-modifying drugs available, if your infrastructure is ready to manage all patients that have preclinical dementia, then you go ahead and do mass screening. But if you are not ready, then it is impossible to do mass screening.
I would agree with that. I think late onset AD or LOAD, as it's sometimes given the eponym, it shares the same clinical and pathological features of early onset AD or EOAD. And to diagnose, to use a biomarker in someone who's over 65, I think that's kind of line in the sand, would not be so effective. However, I do feel that with familial Alzheimer's disease, it is probably worth checking on direct relationships for younger, or should we say the children of the parents or the parent who has AD, to give them an idea of whether they are heading that way. And that would be useful to do if there were clinical and pathological features, so that the younger person could be forewarned and be able to modify possibly or expect the changes in life which might be necessary. Now, there is an ethical issue here in the sense that you may get it wrong. And if you actually have a parent and you're looking at the familial biomarker, that is the importance of the biomarker itself, because it is specific. But if you actually get it wrong and you've told someone that they're going to perhaps suffer from it and they don't get it, then there are two ways to react. A, they're delighted and they laugh at you and say, you got it wrong, you made a mistake, didn't you? Or you still say, thank you, doctor, for warning me, I was prepared, but so far I haven't been affected yet. But it was good to know that that might happen. You know, it's really a kind of argument or discussion that needs to take place. But certainly, I think it's important to differentiate the, if you like, the impact to the patient as well as an economic one and a practical one of delivery. There are hundreds of biomarkers, and you know there has to be, if you like, a common denominator of outcomes. If we use this biomarker, what have we gained by using it? What has been the outcome? And how can we actually improve the health of that particular person?